Welcome to FCP Conversations Online, featuring Bucks County nonprofit leaders. Join our discussion with community organizations that share our mission and are making a difference in the lives of our neighbors.
Hello, I'm Ron Bernstein, the Executive Director of Foundations Community Partnership. Welcome to FCP Conversations Online, and thank you for joining us. Our guest today is Sally Fabian Aresic, the Executive Director of the Ann Silverman Community Health Clinic located here in Doylestown Hospital. Sally, welcome, and thank you for joining us.
Thank you, Ron. It's great to be here.
I don't think everybody knows the history and the mission of the Ann Silverman Clinic. Can you tell us how it started?
Sure. It's an interesting story. About 25 years ago, a young mom with a very sick baby came to a local doctor's office, and the baby was crying and very upset. And the doctor, Dan Nessie, who was an ear, nose, and throat specialist, saw the mom and the child and prescribed a treatment. The mother burst into tears herself and said she couldn't possibly afford the treatment. And Dr. Nessie reassured her that he would make arrangements and be sure that the baby was taken care of. But he was tremendously moved by this incident. And he went to a medical meeting that very afternoon and told his colleagues about it and said, we really need to do something to make sure that the people who live in this community have access to the health care that they need. And out of that, and his determination and cooperation with Doylestown Hospital grew the Ann Silverman Community Health Clinic. It was originally called the Free Clinic of Doylestown.
And it's located in the hospital, am I correct?
Yes, it's located on the ground floor of Doylestown Hospital. That space is donated to us. We are our own nonprofit and have been for the past 25 years, but we use the space and some of the services that are donated to us by Doylestown.
Sally, you've done a great job telling us about the history, how the clinic evolved. Tell us what its mission is.
The mission of the Ann Silverman Community Health Clinic is to provide free health care, medical, dental, behavioral health, social services, and medications to low-income, uninsured residents of Bucks County, and we take care of both children and adults who have no insurance and meet that criteria of being low income and uninsured.
What kind of staff do you have there to take care of patients?
We have a small paid staff and many, many volunteers, about 280 volunteers. The paid staff includes nurse practitioners, a nurse, a licensed professional counselor who's bilingual, a bilingual receptionist, a dental hygienist, and then a very small administrative staff, including myself, an accountant, and a manager for the clinic.
And so physicians on staff at Doylestown Hospital rotate through or give certain numbers of hours a month to the clinic? How does that work?
Well, a lot of volunteers do come from the hospital itself, as well as retired physicians. So we have probably about 25 physicians who volunteer their services. Some are actively in practice, some are retired. A few physicians come in and do a session in the clinic for, say, 3 or 4 hours. Dr. Cody is an orthopedist, and he comes in. Dr. Appelstein comes in. He's a retired cardiologist. So some services are on site. Our nurse makes arrangements with other physicians in the community to see our patients at no cost in their offices.
And so let's go through the kinds of medical services you offer.
We provide basic medical care, dental care, behavioral health, social services, and medications. All the services that you would get at a family doctor's office and perhaps more, because we do include dental and behavioral health services.
And so how many patients do you guys see in a year? Or patient visits?
Well, last year we saw more than 1,500 individual unduplicated patients, and we had 5,300 plus visits to the clinic itself.
And how do those patients pay for that, or what makes them eligible for the free care?
The clinic is completely free. All our services are free. There's no charge and there are no copays. All our patients are uninsured and low income, and the eligibility process is the first step in coming to the clinic. So when someone calls, we talk to them a little bit to find out, do they have insurance? Are they looking for a service that we provide? And we give them the information that they need about bringing some qualifying information into the clinic, and we set up an eligibility appointment. And then when they come in, we usually are able to see them within a week. They bring some information that shows documentation that they live in Bucks County and some documentation of their family income. And from that, we can decide that they are our patient and the services that they need depending on the...
So like you said a family practice, so like going to a family practice for cold or sores or whatever pops up. But what about chronic care, people with diabetes and things like that?
The majority of our patients actually have a very serious chronic illness. Our top illnesses are high blood pressure, high cholesterol, diabetes, orthopedic problems, pulmonary problems like asthma and chronic obstructive pulmonary disease. And we take care of all of those. So most of our patients need to be seen, I would say, somewhere between 3 and 5 times a year for ongoing care. We need to monitor their medications, and we do provide many of their medications. We get those medications through the pharmaceutical assistance programs, and we have volunteers that fill out the pretty lengthy and detailed forms that are submitted to the pharmacy companies in order to get free meds. And then sometimes we give patients a prescription that can be filled for $4, a generic type of medication.
Wow, that's fantastic. So you mentioned about 1,500 individual patients. What percentage of those would you say are children?
About 10% of the people that we see are children. And part of that is because children born in the United States are eligible for the Children's Health Insurance Program called
the
CHIP.
CHIPS program, yep.
Yes. So if a family comes to us and they're uninsured and their children have been born here, we will help them complete those applications for CHIP. If the children have been brought here from another country and they're not eligible for CHIP, then we'll take care of those children. So we see many more moms and dads than we do children because we get many of the children enrolled in CHIP.
You mentioned dental care. Could you walk us through what that covers?
Our dental program is the fastest growing program that we have. We see people for basic dental care, and we call it a hybrid model. So by that I mean we do some services in our clinic itself, and we take care of some services out in the community with our partners. So in the clinic itself, we have 3 dental chairs, and we will see patients have an exam done by a volunteer dentist and decide on what care needs to be provided. We have dental hygienists who come in and clean teeth and do education about proper care of the teeth and gums. We have one volunteer dentist who comes in and does simple extractions, and then we have many partner dentists in the community who will see our patients to take care of their cavities. So it's quite an involved process, and we also have some partners who will take care of the more complicated extractions.
Yeah, okay. What about, do you work with Temple's Dental School, or do you have any rotation of dental students coming through?
We do see dental students from Montgomery County Community College, and they have a program for dental hygiene, and those students come with an instructor and see our patients and do a very thorough job in getting the hygiene done. So that's the teeth cleaning and instruction. We don't currently have an arrangement with Temple, but we do have a partnership with a local organization called HealthLink Dental Clinic. They're located in Bucks County down in Southampton, and we are working on expanding that partnership so that they will see some more of our patients for what you call restorations, or what I would call having those cavities filled.
Okay, you also mentioned behavioral health. Can you tell us the kinds of behavioral health services you provide?
Behavioral health is our newest program. And we really saw as time was going along that many of our patients seemed anxious and depressed. So with the help of funding from Foundation's Community Partnership, we started a program where we do a screening of new patients and we give them a simple tool that we help them fill out if they are not good readers to find out a level of depression and anxiety that they're dealing with. It's a very simple one-page screening tool. And from that, we look at and we score the tool and we decide who might need some counseling help and who seems to be coping fine. And we're finding a significant number of people who are rather depressed and anxious. Much of it comes from their life circumstances and sometimes from their health problems or a combination of both. Now, we're talking about people who don't have much income because in order to come to the clinic, you have to be low income. They don't have any health insurance, and they could be a new immigrant, so coping with all those various factors. And in that way, we see that they might need some counseling services. We have volunteer counselors who come in and do one-on-one counseling. We have a staff person, a licensed professional counselor who's just coming on board with us, and she's bilingual. So that will be a great help because a significant number of our patients speak Spanish. And although some may speak some English, certainly talking about their emotional concerns would be easier in their native language. And then we have a volunteer nurse practitioner who specializes in psychiatric nursing, and she will see people and prescribe some basic anti-anxiety and anti-depression medicines. Now, if people are seriously mentally ill or really struggling, we will refer them to one of the local base service units like Lenape Foundation.
Right. Well, that's fantastic, Sally. Well, at this point in time, you've been there and the place has been up and running for a while. What's your vision of the future for the clinic? Where do you see it going from here?
Well, I'm really excited about where the clinic is going. We just completed an extensive renovation and expansion project because my vision is that the clinic needs to grow to take care of the uninsured people who are coming in faster than we expected into our community. Many of them don't speak our language and are new to our community. So I could see our waiting room was overcrowded. So the expansion project doubled the size of our waiting room. We were able to take some unused space or poorly used space at Doylestown Health right across from the clinic and convert that into 4 brand new examination rooms for medical purposes and a beautiful new storage closet for our medications that we get in. And that allowed us to convert some of our existing clinic space. That was how we were able to make one medical exam room into a brand new dental suite. And we were able to take a former medical room and turn it into a family counseling room. So I see all these services growing right where we are, and I see us expanding who we can take care of, and I'm excited to think that we might be able to take care of more patients in our dental unit as well.
Sally, if people are excited about what they're hearing and they are interested in volunteering or hopefully making a donation to the clinic, how do they do that?
Probably the easiest way is to go onto our website, which is the abbreviations of our name: A for Ann, S for Silverman, C for community, and then the words healthclinic.org. Or you can put up free clinics, and one of the first things that will in the search engine will come up, the Ann Silverman Community Health Clinic. We have a donate button right there, so you can use a credit card to make a donation. We also have drop-down tabs, and one of those talks about volunteerism, and we have a very easy to complete application to volunteer. So we hope that people listening to us right now will think about becoming a volunteer, there are endless opportunities at the clinic to volunteer, whether you have a medical background or not.
That's wonderful. Hey, just one more thought, though. A lot of your patients probably don't have transportation, and public transportation is tough here in Bucks County. How do people get to the hospital?
Transportation is always a challenge for our patients. Many of them do use the services of a friend, which is why we need to have some hours in the evening. We're open Monday evening and Tuesday evening because that's the best time that someone else in their neighborhood or family or connections network might be able to bring them into the clinic. Some patients do use the bus service. Some are starting to use Uber. We do have some very wonderful community members who volunteer through immigrants' rights groups, and they will drive people to the clinic and wait for them and then take them home.
Well, you guys are doing great stuff, Sally. I really appreciate it. We thank you for the great work you guys are doing in Bucks County. Thanks for joining me today to share your experience and educate us about the Ann Silverman Clinic. And thank you to our listeners for your involvement in our community. Visit our Facebook page and like us, and subscribe to our YouTube channel. Join the conversation.
Foundation's community partnership believes that when we join forces, we're stronger. We are better able to support the behavioral health and human service needs of children and young adults in Bucks County. Join us again for FCP Conversations Online. Let's go farther together.